Once your patient screens to be positive and at risk for suicide, meaning they are a low risk, moderate risk, or high risk, you are now obligated to do the C-SSRS risk assessment. Let's review how to do the risk assessment. In EPIC, your electronic medical record, the patient that we just went through the scenario with had an actual suicide attempt. This was yesterday, also within the last 3 months. Gail, I know that you had attempted to take the medications, all the pills, your Prozac and Xanax. Over the lifetime, have you had a suicide attempt?
Yeah, I had one about 2 years ago where I got a whole bunch of pills, but my husband came into the room and took the pills from me.
Thank you. Since the patient's husband was able to interfere and interrupt, we can mark this as an interrupted attempt. Clinical status will now be reviewed with the patient. Gail, are you feeling a hopelessness?
Yeah.
For the purposes of the training, we will not go through all components, but you would want to identify what clinical status your patient has. Gail, are you feeling like you're very depressed, having some major depressive episodes?
Yeah, I'm feeling really depressed. I'm just so sad, and I feel guilty, and I feel overwhelmed, and I just can't. I feel really worthless, and I can't do anything right.
If you notice the patient's also identifying other feelings that's not identified in your clinical status checkboxes, you have a comment box that you can free text within. Feel free to use your comment box. And next I'm going to be reviewing the suicidal ideation that was the most severe in the past month. Gail, you reported to me that you wished you were dead. Is that still how you're feeling?
Yeah.
And then you also had a plan in place to take all the pills, the medications that were prescribed to you.
Yeah.
So I would also be marking suicidal intent with a specific plan. Notice how you can mark a couple of options within the risk assessment. Next, we'll be reviewing the activating events, so recent events that might have triggered this patient's behavior. Gail, can you tell me if there's been anything that's recently been different that might warrant triggering some of these emotions, such as financial issues or problems? There might be some work issues or problems, loss of a parent. Okay.
I've really had, some struggles at work, but I've really been, since I've been feeling so bad, I've been trying to spend a lot of money, and God, I spent too much money, and my husband's upset about it, and we don't have any money anymore, and we're in debt way over our heads, and it's just so overwhelming.
Thank you. I'm sorry to hear that you're going through these problems. You're in the right place, and we're going to take care of you. We're next going to be reviewing the protective factors. So do you have a reason for living? Can you identify a purpose to live?
Well, I really wasn't thinking that I wanted to live. I thought the pills would kill me, and I'm surprised they didn't. But I do have kids, and I do have a husband, and they seem really upset that I did this.
Okay, and how about work? Do you have a job that you like and that you feel purpose with?
Well, I kind of like my job.
Next, we're going to be reviewing the treatment history. if there was a previous psychiatric diagnosis and treatments. Have you had a previous psychiatric diagnosis or treatment?
Yeah, they told me I had depression, a couple of years ago when I had those pills in my hand, and my husband took them out, and then he made me go see a counselor, and they told me I had some just really, severe depression. And
okay. And do you feel that the treatment that you were currently going through, were you dissatisfied with the treatment? Did you like the treatment?
yeah, it's not working. It's just not working. I'm not feeling better at all.
Okay. And were you taking the medications as prescribed? Were you compliant with your treatment?
Some days I'd forget.
Okay. Thank you. Within the risk assessment, you also want to identify the plans to mitigate the risk for suicide. So if your patient's at risk for suicide, we should be marking what the mitigation plans are. Notice here how you have lots of options to choose from. The patient's a high risk for suicide. All high-risk patients will require a one-to-one in-person patient monitor, which is also called a patient sitter. I can also do my environmental room risk assessment. I'm going to increase my rounding. I'm going to notify my provider, remove some other items within the patient's unique room for that patient, and start my safety planning. The risk assessment portion has been completed.